Today, we have a super important topic for everyone, especially for our older adults and their families, and we'll be discussing it with our dear doctor, Adler. Did you know that thousands of seniors end up in the hospital due to falls inside their own homes? What's most concerning is that many of those falls could have been prevented with one simple change, something that often goes unnoticed in daily routines. In this episode, we're going to reveal what that silent mistake is, that small, everyday oversight that almost no one suspects, but that can lead to serious consequences. Fractures, loss of independence, and hospitalizations that affect not only the body, but also the life and autonomy of those we love most. And we won't just talk about the physical side of things. Soon, we'll also explore how these falls affect the emotional state of older adults, leading to fear, anxiety, and often a reluctance to move again and reclaim their freedom. Because we know that fear can be just as paralyzing as the fall itself. But before we dive into the details, let's welcome Dr. Adler. Doctor, why do you think so many older adults fall inside their own homes? What are we doing wrong, without even realizing it, that puts our loved ones at risk? Doctor.
Thank you for the warm welcome. For those tuning in for the first time, let me introduce myself. I was born in China, and I've spent over 25 years dedicating my professional life to caring for older adults in the United States. Every patient I've cared for has left a mark on me, not just through science and data, but through the human stories behind each case. I work with my heart in every story and my mind grounded in scientific evidence. When we talk about falls, many people believe they're caused by extreme weakness or the obvious fragility of old age. But the truth is, most falls happen because of small, invisible details, those that go unnoticed but can be very dangerous. A poorly placed cord on the floor, a rug that isn't secured properly, a dark and poorly lit corner. These are the real silent enemies lurking in the home. A fall isn't just a physical blow. It can cause serious fractures that permanently change someone's quality of life, lead to a loss of independence and mobility, and, something people often forget, it can also destroy a person's self-confidence. In this episode, we're going to dive deeper into not only how to identify and fix those hidden dangers, but also something just as important: how to prevent the fear and insecurity that often take root in the heart after a fall. Because emotional well-being is key to regaining independence and moving forward. And in a bit, we'll also talk about how to prevent the emotional fear that follows a fall.
Honestly, Doctor, I can totally picture this happening a lot because I see so many cases at the hospital. But tell me, is there one mistake or oversight you see more often than any other? That silent mistake, hiding in homes that almost no one notices. But that can cause major problems?
Absolutely. And believe me, it's not what most people think at first. It's not just that someone is weak or lacks strength. The environment plays a huge role. The most common mistake I see is poor lighting in the areas people walk through most. Dark hallways, poorly visible corners, or flickering lights that confuse the brain.
Ah, I get it now. So someone might be perfectly fine. But if they can't see where they're stepping, it's like walking blindfolded on a tightrope in their own home.
Exactly. And the worst part is that this mistake goes unnoticed because no one thinks to check the hallway light before going to bed. But that small oversight is what causes the most accidents. Later on, we'll share how to fix it without spending much or having to remodel the whole house. And I say this with deep concern because I've seen too many cases. The most common one: someone gets up at night, heads to the bathroom without turning on the light, and trips over something.
Right, either to not bother anyone, or because they think they know the way by heart.
Exactly. I clearly remember Mrs. Elena, a 78-year-old woman. She used to walk every day, cook, knit, very active. One night she got up to get a glass of water, didn't want to turn on the hallway light so she wouldn't wake her husband, and tripped over her own cat. She fell sideways and fractured her wrist. It wasn't a serious fracture, but the most painful part was what came afterward.
Losing confidence, right?
Yes, from that day on, she was afraid to move around on her own. She stopped doing many of her daily routines. And that fear, it starts to take away a person's independence. All because she didn't turn on a lamp. And I don't say this to scare anyone, but to help us understand this. Sometimes what seems like a small detail, like a light bulb that's off, can end up dimming an active life.
Wow, that really changes everything. We think it's the big things, but sometimes the simplest ones hurt the most. Stay tuned. This is just getting started. Dr. Adler, how can someone spot and fix this problem without spending a fortune? Because that's such an important point. Doctor,
That's why I want to share with you 5 concrete and simple actions that can greatly reduce the risk of falls at home. They don't require major investments or fancy technology, just intention, observation, and care. Here are 5 practical steps. 1. Strategic lighting, automatic lights in hallways and staircases, brighter LED bulbs in areas walked through at night. 2. Remove obstacles, move cables, fold or secure rugs, and rearrange furniture to avoid blocking walkways. One of the most common but easiest to overlook factors in the home are the obstacles that can lead to trips and falls. That's why it's essential to examine every space we walk through daily and make a few simple but very effective adjustments. For example, power cords that are left lying on the floor can be a real hazard. It's important to move them, secure them with special tape, or better yet, run them along the walls or behind furniture so they're out of the way. Rugs, which are so common in many homes, can also be a trap if they aren't secured properly. Curled corners or uneven bumps can easily cause someone to trip. Using non-slip pads underneath rugs or removing old ones entirely is a great idea to prevent accidents. Also, rearranging furniture so it doesn't block hallways or common walking areas helps create wide, safe spaces to move around. That includes avoiding items left on the floor, like shoes, toys, or anything else that might become an unexpected obstacle. Small changes like these made mindfully can make a big difference in turning the home into a safer place, free of hidden dangers.
it's amazing how something as simple as a cord or a rug can pose such a big risk, right? Sometimes we don't even notice these things because they're just part of our daily routine. And many times, those things that seem so minor can cause very serious falls, especially for older adults who already have slower reflexes. That's why it's vital that not only seniors, but also their families and caregivers stay alert to those little details to help prevent accidents at home. Because safety doesn't only depend on the environment, it also depends on what we use every day.
Exactly. And speaking of that, one key point that often gets overlooked is footwear. That would be the third point. Wearing the right shoes can make a huge difference in preventing falls. Non-slip shoes or firm slippers, no loose soles allowed. It might seem like a small thing, but it's actually critical. Many older adults walk around their homes in old slippers, smooth soles, or even barefoot. That's a big risk. The ideal footwear is non-slip shoes or firm slippers with a solid base that fits snugly around the foot. No loose soles, no heels, and none of those shoes that easily slip off.
Doctor, I have to stop you right there, because I see that all the time. People come to the hospital after a fall, and when you ask them, they say, "I was wearing flip-flops," or "I slipped in my slippers." We don't give it much importance. But footwear can be the difference between staying steady or losing your balance.
Exactly. I always tell my patients, if you take care of your shoes, you're taking care of your safety. It's not about spending a lot of money. It's about choosing wisely. Look for footwear with rubber soles that don't slip, shoes that stay securely on your foot, and above all, shoes that feel stable.
And that applies even when you're just inside the house, right?
Absolutely. Many falls happen in the kitchen or the bathroom, where floors can be wet. So even at home, the best choice is safe footwear. Think of your feet as the foundation of your balance. If they're steady, your whole body is better protected. Now let's move on to the fourth step, which is 3. Grab bars and support handles. In the bathroom, bedroom, and staircases. They cost very little and prevent many falls. This isn't a luxury, it's a necessity, especially in the bathroom, where the combination of water and smooth surfaces can make it very slippery.
Absolutely. A lot of the fall cases we see happen right when a person is stepping out of the shower, or even while trying to sit down or stand up from the toilet. It only takes a few seconds, but it can change everything.
Exactly. And what's most concerning is that many homes don't have a single bar installed. For a very low cost, you can place grab bars in key spots, inside and outside the shower, next to the toilet, in hallways, staircases, or even beside the bed. It's not just about physical support. They also give people confidence when moving around.
Right? Because it's not just about avoiding a fall, it's also about helping the person feel safe and independent. There are people who avoid showering alone out of fear of falling, and that gradually affects their overall well-being.
And here's something very important. You shouldn't wait for an accident to happen before making these changes. Grab bars can be installed in under an hour and may prevent a hip fracture, which often leads to hospitalization and loss of independence.
A minimal investment that could save a life. And if someone's listening right now and doesn't know where to start, the first thing they can do is check their bathroom today. Is there a surface where someone might slip? Is there something sturdy to hold on to?
Very well said. Prevention doesn't cost nearly as much as recovering from a fall. And sometimes a single well-placed grab bar is the difference between just another routine day or a medical emergency. Check vision and balance, annual eye exams, simple balance exercises like standing on one foot for 30 seconds.
And the best part is that many of these things cost next to nothing. A plug-in nightlight, a stick-on grab handle, or even a grandchild helping to move some furniture can make a big difference. Doctor, what you just mentioned in these 5 practical steps is really interesting. We know that changes in vision and balance are common with age. How important is it to check those aspects to help prevent falls at home?
It's essential. As we age, our vision can weaken, and sometimes we don't even notice. A slight loss of vision can cause us to miss an obstacle or send confusing signals to the brain about where we're stepping. That's why I recommend an annual eye exam, even if there aren't any obvious symptoms.
And what about balance? To me, it seems like something many older adults don't train, and that increases the risk.
Exactly. Balance is a function that needs regular training, just like muscles do. There are very simple exercises anyone can do at home to improve it. For example, standing on one foot for 30 seconds, or walking in a straight line by placing one foot directly in front of the other, as if on a tightrope.
And are these exercises safe for everyone?
Yes, as long as they're done carefully, and ideally near a wall or with someone nearby, just in case. The important thing is to start slowly, with basic movements, and increase the duration over time.
Perfect. Any other tips for improving balance?
Yes, activities like Tai Chi or senior adapted yoga are excellent because they combine strength, flexibility, and focus. Even daily walking is very helpful.
So, to take care of your vision, get an annual checkup. And for balance, do simple daily exercises. No special equipment needed. Sounds very doable.
That's right. And with these simple habits, you can significantly reduce fall risks and gain the confidence to move freely.
Very clear. Could you share some simple changes our listeners can make today? Before this episode ends?
Of course, before going to bed tonight, turn on a low-intensity hallway light. Fold up any loose rugs. Install a grab bar next to the toilet. Try on a pair of stable, comfortable shoes. Doing these 4 things can dramatically lower your risk.
Doctor, earlier we mentioned we'd talk about a very important subject. What about someone who's already fallen? Is it just a physical injury? Or is there an emotional toll too? I know this is a difficult moment for many, because we're not just talking about bruises. We're talking about the pain inside when someone feels like they can no longer trust their own body.
That's a great point. This is a delicate but absolutely crucial topic. After a fall, it's not just the physical pain that remains. Something deeper and more silent appears. Fear. The fear of falling again, of not being able to get up, of becoming dependent on others. And that changes everything.
I imagine the person starts moving less out of caution.
Exactly. To avoid another fall, many stop going out, get up less, stop doing basic tasks, and that's where a dangerous cycle begins. Less movement, shocker, more muscle weakness, and less balance, shocker, higher risk of falling.
And not just that. I've also seen sadness. Even people who were once active and cheerful become more withdrawn after a fall.
Yes, confidence is lost, self-esteem too, and anxiety appears, sometimes even depression. But I want to say something very clearly. This is not the end. You can move forward.
And how do you break that negative cycle, doctor?
With support, emotional and physical support. First, gradual movement. For example, short walks inside the house with someone next to them, then on the sidewalk, then at a park. Physical therapy helps a lot too, or gentle group classes like yoga or senior fitness.
I like that. Like a kind of training to trust again.
Exactly. And also, talking about it. A psychologist, a support group, or even chats with friends or grandchildren. The body needs time, but so does the soul.
Doctor. And this affects the family members too, right? Sometimes, with the best intentions, they end up being overprotective.
You've touched on a very sensitive topic. Many times children or grandchildren, after a fall, want to take such good care that, without realizing it, they end up limiting the person. They don't let them walk alone, don't allow them to cook, don't want them to go out.
And that reinforces the fear, right?
Yes, overprotection, even when it comes from love, can be very harmful. The person starts to feel useless, dependent, and that, emotionally, weighs more than the fall itself. The key is to find balance, support without taking away autonomy. Be close, but allow the person to regain their space, their routine, their small daily achievements.
It's hard, doctor, because as a child, a nephew, or even a grandchild, you want to prevent them from getting hurt again. But I realize that in trying to protect, we sometimes end up trapping those we love in an even greater fear. Honestly, it moves me to hear what you're sharing, because I've seen many older adults fade after a fall. And with a little patience, a little trust, directed toward them and walking alongside them, they bloom again.
That's exactly right. The fall doesn't define the future. What comes after does. With the right environment, physical and emotional support, many older adults regain not only their mobility, but their joy, their inner strength. And that's the most valuable thing.
Doctor, so far we've talked about silent mistakes inside the home, floors, rugs, poor lighting, but I wonder, what about the body? How much does being physically trained help in preventing a fall?
Absolutely. That question is key. Many people think falling is just about a misstep, but your physical condition makes the difference between falling or not, and also in how you fall.
So, if the body is trained, even if a fall happens, it can handle it better?
Exactly. A body with muscle strength, good coordination, and reflexes not only falls less, it also protects itself better when a fall happens. Think about it. Someone with strong legs, good ankle mobility, and trained balance has a much better chance of regaining their step, or at least softening the impact.
How important. And there are older adults who don't exercise at all because they believe it's too late to start.
That's one of the most harmful myths. It's never too late. The human body responds to movement at any age. Of course, exercise has to be adapted, but there are safe and very effective routines. Daily walks of 20 to 30 minutes. Balance exercises like standing on one foot, walking in a straight line, or exercises with a chair nearby. Gentle muscle strengthening. Lifting bottles with your arms, sitting and standing from a chair without using your hands. Flexibility and coordination. Ankle circles, simple stretches.
And this can be done at home.
Of course, many of these exercises can be done in the living room, with a chair or a mat, but ideally a doctor or physical therapist should be consulted first to adapt the movements. And if possible, do it in a group. Classes at community centers or clubs not only help the body, but also lift the spirit.
That's what I was getting at, doctor. What about the five senses? Sometimes people believe that once you're over 70, you're doomed to lose your reflexes or strength.
It's true that aging brings changes, but it's not destiny. With physical training and proper mental stimulation, many people in their 70s, 80s, or more keep their reflexes sharp, maintain balance and agility. And that has a direct impact. Fewer falls, more independence, more dignity.
Beautiful. I'm holding on to that. More dignity. Because what's at stake here, doctor, isn't just the body. It's also self-esteem.
Yes, exercise isn't just physical prevention, it's an act of self-love. Moving each day, even just a little, is a way of telling your body, you're still alive, you still can.
And now, the moment everyone's been waiting for. Doctor, give us that boost we all need to start moving. Without fear, with purpose, with self-love. Before we close this part, would you leave us a challenge? Something short, that any older adult can start today?
Absolutely. This is the 5-minute Vital Challenge. Simple, safe, and very effective to work on balance, strength, and confidence. 1. Gentle warm-up. 1 minute. March in place, with or without the support of a chair. Arm movements as if you were hugging the air. 2nd, stand on one foot, 30 seconds per leg. Use a chair next to you for support if needed. Focus on a fixed point in front of you and breathe deeply. This exercise trains balance and concentration. 3. Sit and stand from a chair. 1 minute. Do it slowly, without using your hands if possible. Keep your back straight. This strengthens thighs and glutes, essential for safe walking. 4. Walk in a straight line. 1 minute. Imagine a line and walk heel to toe, one foot in front of the other. If you're with someone, ask for supervision. This helps with coordination and body awareness. 5. Final stretch. 1 minute. Stretch your arms upward, then to the sides. Gently rotate your neck and shoulders. This relaxes and improves overall mobility. The important thing isn't doing a lot. It's doing it every day. With consistency, these exercises change the body and also the mind. They boost confidence, independence, and mood. Don't underestimate the power of moving just 5 minutes a day.
What a wonderful vital challenge, doctor. And I want to say something to everyone listening. This is the moment to start. It doesn't matter how old you are. It doesn't matter if today you feel a bit slow or afraid. Your body is waiting to move. And with just 5 minutes a day, you can regain the strength, confidence, and balance you thought you had lost. If you're joining us, write it down. Comment. I start today. That way, we can see how many of us there are and inspire others to take that first step. Share this with your children, your grandchildren, your walking group, or your local senior center. Let's make this challenge go viral. Because yes, prevention can begin with a simple decision. And with movement. Doctor, we're all in. I'm starting today. How about you?
Absolutely, I'm joining you. Because this challenge isn't just exercise. It's a way of telling your body, I'm still here, I'm still alive, and I want to keep moving. And let me say something important. There is no medicine more powerful than consistent, mindful movement. I've seen people in their 70s, 80s, even 90s start with tiny steps, and within weeks they were walking better, sleeping better, even smiling more. This challenge is just the beginning, and if you do it with someone, a friend, a grandchild, a neighbor, even better, because exercise is also connection, joy, and rebuilding self-trust. So yes, I'll say it with you all, I start today, and I'm sure will inspire many more. If you're out there and still unsure, I'm talking to you. It doesn't matter how many times you've stopped. Today you can begin again. This challenge is this is your moment.
Doctor, thank you for your clarity and warmth. I think I'll take away something powerful. Prevention is an act of love that costs nothing, just attention.
Exactly. I want everyone to remember this. A fall can change a life, but one small action today can prevent it forever. So, check the lighting in your home, remove obstacles, wear proper footwear, install grab bars if needed, and don't forget to move your body and mind every day, even if you've fallen before.
Well, there you have it. It's already started. And if you're listening to this right now, this is your moment. It doesn't matter if you're 65 or 85. What matters is deciding. Leave a comment that says, I start today, and join this movement and health challenge. Because walking, stretching, strengthening can change your life. And now I ask you, the one listening on the other side, what will be your first exercise today? And who will you do it with? A friend, a daughter, your partner, or even your dog? We'll read your answers. And who knows, maybe your story will appear in the next episode.
Also, remember this. Every fall avoided is one more story to live, one more laugh, one more walk, a life with more confidence and dignity. If you're listening to this, I congratulate you. You're choosing to take care of your body, and that is always the first step. But pay attention, because in the next episode, we'll talk about something even more silent, more dangerous, and not visible at first glance.
Just like the body needs light, balance, and strength, there are also things we don't see that weaken us even more. What we're going to talk about in the next episode isn't about physical falls, but something that affects us from within. Did you know there's something weakening the bodies of millions of older adults, even more than many physical illnesses? And the worst part is that many don't even realize they're suffering from it. The doctor is going to tell us what it is, something that can affect your muscles, your heart, even your immune system.
It's one of the most serious, invisible illnesses I see every week, but there are also ways to heal it. You're not alone.
We'll see you next week. And if you know someone who needs to hear this, share this episode with them. This was Vital Steps, because every step counts, but no step is taken alone.